Hello and welcome to the today webinar about diabetes. My name is Dr. Yusuf Said. I'm a diabetologist and internal medicine specialist working at GluCare Integrated Diabetes Center. I'm seeing already that some people are already questioning, so at the end of this webinar, I will answer the Q&A questions. The COVID disease reached the whole world and developed into a pandemic. We know about diabetes that has already developed like an epidemic and has affected many countries and population. 463 million people have diabetes. That's about 1 of every 11 people you know that can have diabetes. And what worries is that 1 out of 4 don't know that they have diabetes. There are 3 main types of diabetes. It's type 1 diabetes, type 2 diabetes, and gestational diabetes. In the type 1 diabetes patients, the patients cannot produce insulin. Type 2 diabetes is a typical lifestyle disease. So you have insulin, but it's not working well. I'm always giving my patients the example. Think about you have a neighbor, he's coming every day, knocking on your door and bringing 20 guests with him. One day you will say, come on, it's enough, yes? And the same is happening in your body in type 2 diabetes patients. So insulin is coming into the cells and saying, look, I have brought you glucose, so it's sugar. And the cell will then say after times, I'm not accepting you. So you're getting insulin resistance, and the glucose is getting high in your blood. The third type is gestational diabetes. Through hormonal changes in the pregnancy, you can get that your blood sugars can elevate it. Well, how you can detect that you have diabetes? Mostly in my patients, they're coming because they have extreme fatigue and feeling tired. Some of them have frequent infections, virus infections, and what is mostly common is that they have an unusual thirst and they're going frequently at the night to the toilet. There are, of course, many other symptoms, and if you have always detecting something like them more frequently, please go to your health provider. Let's take a deeper dive about the 3 main types. So I already mentioned that diabetes type 1 is an autoimmune disease. So this means that your own body is destroying the cells in your body which is producing insulin. And therefore these patients need their lifelong insulin as a medication. It's unfortunately not preventable. And the causes we know till now are more generic and environmental factors. It's only 5% of all cases of diabetes, but it's growing with the times. The main type, 90 to 95% of all cases are diabetes type 2, a lifestyle disease. Yes, so people with obesity, older age, a positive family history of diabetes can get type 2 diabetes. The treatment is mostly, and this is the first treatment, is healthy diet and an increase in exercise. And if you're not well maintained or have very high sugar levels at the beginning, you need sometimes medication or insulin. Gestational diabetes is only occurring in women with a pregnant woman. The risk factors and treatment are really similar to type 2 diabetes, and both are preventable through lifestyle change. Every pregnant woman is screened during the pregnancy for gestational diabetes. So if you don't treat your diabetes or don't well manage it, you can have severe complications. Your small blood vessels, your big blood vessels can be damaged. So you can get a stroke, eye disease, heart diseases, and kidney diseases. Your immunity gets down and you can have wound infections and with complications, nerval damage, and even dementia and depression because of diabetes. So as you can see, we are speaking about only one disease, but it has effect of so many parts of our body. Well, how we can prevent diabetes? And that's mainly through changing your lifestyle. Healthy diet by choosing the right food, maintaining your weight, and especially through physical activity. We are recommending at least 150 minutes exercise per week. We even say you should do 3 times per week, minimum 30 minutes, cardiac training. And 2 times per week, you should do something for your muscles, strength training, because we know that muscles are really important for your metabolism. So if you have more muscles, you can increase your metabolism and avoid diabetes. It's also very important if you have, for example, symptoms, but also with age, to go regularly to your checkups to your physician. So to detect as soon as possible any signs for diabetes. Well, one of the main key points of lifestyle change is, of course, to make the right choice of food. So through smart food swaps, yes, you can already start to prevent type 2 diabetes. So use brown bread instead of white bread, yes. Choose sweet potato instead of French fries. And make the amount of leafy green vegetables more on your plate. What is important for treatment and management of diabetes? Yes, sometimes you will need medication. If your blood glucose levels are too high, it's only not possible to do it through lifestyle change. But we know that if you change your lifestyle, in long term, you can go away of medication and maintain your diabetes. So it's important to take care of what you're eating. It's important to maintain your weight and do the exercise regularly. You have to do your checkups and to control your blood results. And we know that diabetes is connected with other diseases, blood pressure, high cholesterol. So all these has to be checked always regularly. And of course, for those who are smoking, kick the smoking habit. For me, before I end, I want to tell you as a physician, it's always important how you can manage and see what is happening with your patients. So with the environment of technology, we can now much better follow up our patients and manage them. Through continuous glucose monitoring, through digital therapeutics, we can see data and give the patient a feedback. The patient on itself can get a better insight of him and see what is happening in my body if I'm eating this, if I'm doing this type of exercise. How is changing lifestyle my body? And that's what is happening. So with remote monitoring platforms and clinical care teams in your background can help you to manage and treat your diabetes or even prevent to get diabetes. And we as a care team can see much faster what is happening in our patients and help them to treat and manage diabetes better. So thank you very much. Now I'm free for any questions. So it's only here. Okay. Yeah. So I see somebody's saying lifestyle change, Sean control this. Yes, as I mentioned, important is if you have diabetes to see how your blood glucose levels are. Some levels are so high that at the beginning you will need medication. For those who have diabetes, but the levels are not so high, we always, and the guidelines is already saying you should start with lifestyle change. And lifestyle change means, again, changing your diet and doing more exercise. Losing weight is a key component. We are seeing a lot of patients who are losing weight and their glucose levels are getting better. And not even that, if they have cholesterol, this is getting better. Blood pressure is going down. So some patients even are going out of their medication because of lifestyle change. So it's really important, and one of the main components of treatment of prevention of a metabolic disease like diabetes. Another question what I'm seeing is what I should eat, what I should avoid. Look, there is not really one diet which fits for everybody. So what we are doing and mostly recommending is, first let's analyze you. Let's see what is your habits, what are you eating generally by using digital technology. And through this analysis, we can give you as a care team, our nutritionist, the right amount, the right form of diet, which should be for long term. Yes. So it means I can put you on a diet which is really restricted and you can lose weight for 3 months. But I'm sure, and that's the data already showing, that this cannot be something for long term. So we are trying slowly to make changes, behavioral changes, with the support and giving feedback to our patients what is happening. And our aim is that after the program which we have created, the patient is saying on himself, now I know what to do. Now I know how to change and maintain my lifestyle. So education is one of the main components, and we are telling our patients what can affect you. Every patient has a different metabolism. That's also really important to know. So some people are carb types. They can eat carbs and it's not affecting them. But if they eat proteins and fat, that makes them obese. Yes. So again, with new technology and everything what we are learning today, it's now much better to see and create an individual therapy and diet for our patients. So let me see if there are other questions. New, I should go to new, yes? Let's say, yeah. So I'm seeing one question is about type 2 diabetes. So again, it's a lifestyle disease. It is about insulin resistance. It's about that insulin, it's not proper working in your body. It's there, but it's not working well because through our life we had too much, the high amount of glucose. Yes, and we have to think again that other diseases, for example, obesity, is affecting insulin resistance. We know that obese patients, their fat tissue is producing own hormones and metabolic signals, which is disturbing your metabolism and increasing insulin resistance, which means that it not work very well in your body. Another interesting question is, will a type 2 diabetes patient develop cardio problems? Yes, because high sugar levels are toxic. So it's independent if you're type 1 or type 2 or gestational diabetes. If you have high levels of glucose in your blood, this can be toxic and then damages blood vessels and cells generally, and can make problems like cardiac diseases. Somebody asking about what we are doing at GluCare and about the technology. So we are connecting our patients with a band which is getting data about your sleep, about your movements, about your heart rate and skin temperature, and a lot of other data. For type 2 diabetes or for diabetes patients, we have two options. The normal way is that you're measuring your sugar through a BGM, blood glucose meter, on the finger. The second one is a continuous glucose monitor. It's a small patch that you're putting on your skin, and it's continuously sending your glucose values to you on your phone and to us as your care team. So we can see immediately what is happening. And for me as a patient, if I'm changing your medication, your treatment, I can see already after a week, is it successful or not? I don't have to wait the 3 months, which is the regular meeting between a physician and his patient. So we are seeing what is happening in between these times. We have an AI system which is collecting all of this data and actually predicting over 19 diseases. So we can start also to prevent and see if you don't have diabetes, but you're at risk, to give you a feedback and start with lifestyle change. So type 1 diabetes involved in pregnancy. Mostly gestational diabetes patients are at risk to get type 2 diabetes. So as I mentioned before, because it has to do with lifestyle, in pregnant women also because of the changing of hormones. I said already before, you can prevent to get gestational diabetes. For example, if you're overweight and obese before pregnancy, to start already to change your lifestyle and losing weight. This will prevent you to get gestational diabetes. Type 1 diabetes, as I mentioned, is an autoimmune disease, yes, especially in children and young adults. And it's really generic or environmental factors. For example, infections can make type 1 diabetes. We have sometimes also gestational diabetes patients who can get type 1, but it's very rare. But what we are doing is, and this is also the guidelines, that women with gestational diabetes have to be very close monitored after gestational diabetes. So they have to screen for diabetes, yes. And what we're doing always is, if somebody has the risk to get diabetes, we are always not looking for type 2. We are always looking also for signs for type 1 diabetes. Somebody's asking, I'm doing everything for what I have said for managing my diabetes, but I have still diabetes. Diabetes is not reversible. Yes, diabetes you can get in remission. It means if you maintain well, you can have normal blood glucose levels like anybody else. And also your risks can go down like anybody else. But through, for example, a genetic predisposition or other causes, your risk to get complications is still higher than other people. Therefore, if you have diabetes, we are always saying you have to come every 3 months to the clinic, even if you're well maintained, because the risks to get other diseases like blood pressure or cholesterol is higher, and we have to look always after that and see if there are symptoms for that. So therefore, if you're doing everything what I have said and you have good blood glucose levels, then you are doing already great. And that's nothing more to do. So somebody's telling that he's taking cholesterol reducing drugs. The cholesterol is going down, but has impact on blood glucose levels. It's true. There are some studies showing that certain medications for cholesterol can increase the risk of diabetes. Now we have to think about again why you're getting high cholesterol. And then you will see again that it's a metabolic disease, yes? So the wrong choices of food, less of exercise, obesity, can you get to high cholesterol? So not only taking medication is the importance. The importance is also to change your lifestyle. Only then you can be effective and avoid to get the sugar levels, what you explained. But it's right that if you take your cholesterol medications and not do anything else beside this, the risk to get diabetes is there. Yes, can you please show the symptoms of diabetes once again? Yeah, can we show this again one time? Should I click here? Yeah. Just a second. Thank you. So what we are, let me make it a little bit bigger. So here are some of the symptoms of diabetes. Yes, there are of course many more because everybody is not the same. Yes, so I already mentioned that you can get more frequently ill, for example, as a symptom of diabetes. And it's not only these symptoms what you can see. People can have digestion problems suddenly, and it can be a sign of diabetes. Fatigue, which is this tiredness, concentration problems, not working as you can do before, these can be typical signs. You can see weight loss is a sign. You can have increased hunger. Your vision can change. Yes, so you have seen normally TV before, and suddenly now it's changing. So this can be a symptoms. People can get nail fungus infections or on the toes. This can be a sign for diabetes. So again, it's mostly individual, but these are some typical signs for diabetes which can occur. Okay, let's see, there's something else. Yes, somebody is asking what are the symptoms of low sugar. Low sugar can occur in different types of patients. Of course, of those who have diabetes and are treated with medication, but it can also occur as a symptom for those patients who are pre-diabetes. It means, for example, those who are pre-diabetes, if they're eating and after eating suddenly getting really tired. Yes, and they want directly to sleep. We have seen studies that have shown because of the insulin resistance and the metabolic disorder, these patients are eating, the glucose is going down, up, and then the insulin is increasing. After the glucose is going down, the insulin remains high because of the disorder. And what happens is the glucose is going too fast down, and you can have really symptoms like really feeling tired, you can sweat, and these are one of the symptoms. You can have concentration problems, and the most dangerous thing is for hypoglycemia, for low sugar, is that you can get in coma. Yes, you can be suddenly cannot remember something, and your communication can change. You can speak really slowly, and the vision can change. You can get a blurred vision. So these are one of the symptoms of low sugar. Somebody's asking a very nice question. How much percent weight loss is allowed? Allowed is a lot, but what we are saying is that you should lose around 5% of weight in 6 months. So this means effective lifestyle change. Yes. So if you have a weight of 100 kg and you're losing 5%, it's 5 kg in 6 months. So it is possible, and I think what we're experiencing here, it's mostly important that the patients are using the technology to see this improvement. Yes, if you see that your steps are going down And I didn't speak till now about sleep, how much is impacting your metabolism, which is really important. And of course, if you see the spikes of your sugar, if you eat something and later avoid this can all help, of course, to reduce your weight. So yes, you can reduce weight. We have seen great results for patients who have lost a high amount of weight over a year, for the example 15 kg, and they went after that without medication. So they did not need any medication more for their diabetes. Yes, somebody is asking again about early warning signs, diabetes risks and further complications, and prevention and diabetes management. So I have already explained a little bit about the science and the risks. And what is now important is prevention. To go now a little bit more about that, and a diabetes program. So we have created a disease management program. And this disease management program, our patients, as I already mentioned, will connect it to a remote monitoring platform. We are providing, in this time of 12 months, our patients with education material in a really simple form to understand what your disease means, how you can prevent it, or how you can manage it better, and what you should do to do right lifestyle changes. We have a coaching system where you're chatting frequently with somebody who's giving you feedback of what you're doing. And you're always connected with the clinical care team, an educator, a dietitian, and a physician, if there are always any questions. So somebody's asking, I am on type 2 diabetes medications, and what is the best way to come out of this medication, and what are the average sugar levels to need to maintain diabetes? Yes, medication, yes. First important step, and I'm repeating this today a lot, is lifestyle change. So to have the right diet and to do the right amount of exercise, to have a proper sleep. Stress management is extremely important, because all of these things can change your body, your hormone levels, and all these things also can impact your sugar. The normal sugar levels for diabetes patients are, if you're fasting, you should be between 80 to 130. And you should be 2 hours after you're eating under 180. We are using as a normal form the HbA1c to say how our patients are. HbA1c is telling us, it's a blood test, and it's telling us the average of your glucose in the last 3 months. For diabetes patients, it should be under 7%. We are seeing now and learning now, with the days of using new technology, that time and range is much more important. So by using a continuous glucose monitor, we can see how you are during the day. And as I mentioned, it's important to be in these ranges which are explained. And if you're going out and doing spikes, we know that these high spikes are causing the damage in your body. So you can have a great HbA1c of 6.8, and you're in the normal range for a diabetes patient. But if you're spiking during the day, up and down, this is what is causing the damage in your body. So yes, till now, the normal health providers are using HbA1c, but with new technologies, we can see, and there are a lot of studies already now, that is showing that time and range is much more important. And therefore, I ask this question, where you should be as a diabetes patient. Yeah, I think hopefully I have. Oh, they're new. Let me see. Yes, so I have a really nice comment here from somebody who's 15 years as a type 1 diabetes patient, and she or he is saying that she tried already 3 times of insulin, and so that lifestyle is not a problem, along with exercise management and mental pressure is very much needed to manage diabetes. I agree fully. As I mentioned, and I can explain a little bit more about type 1 diabetes. Type 1 diabetes, as I said, is that your body cannot produce insulin. It means you have now to give you the right amount of insulin. And this can be very difficult because you have to see what are you eating, what is the amount of carbs in this meal, and then you have to adjust your insulin and give the right amount to avoid spikings. And you have to see that you're not giving too much to avoid low sugar, which is really dangerous, as I mentioned before. So I'm always saying to my type 1 diabetes patients that I have a full respect for these patients. It's a life-taking disease. This will change your life, and you need a lot of discipline, and you need a lot of management skills to manage this disease. And again, and that's what we are thinking, why using digital technology and having a care team behind you connected is so important. I have a lot of type 1 diabetes patients who are coming to us and they say, I'm left alone. Nobody is helping me really. Yes, especially those who are coming with the newly diagnosed diabetes. In children, especially the parents, it's a disaster because they have to do the most work for their children. So to have somebody who's guiding you all the time is connectable for you and giving you as soon as possible a feedback because we can see this data, it's a big benefit. So you have the feeling that you're not alone with this disease. Yes, generally, also there, lifestyle is very important. And I'm always mentioning, especially for chronic diseases like diabetes, it's not really about that you're a great physician or that I'm giving you the best medication. It's about the management. This is a management disease. And if we are giving our patients the right tool for management, they can improve definitely their treatment and their management of diabetes. Somebody is asking a nice question. Can fruits like watermelon, banana increase sugar levels in body, especially for a person of age 40 or higher? It can increase it for everybody. Yes. It's always important the amount of what you're eating. Yes. Of course, we know that from fruits, the glycemic index is lower than if you eat a chocolate cake. What this means, in fruits, the sugar is going into your body, but it's going slowly into your blood. But if you eat highly processed food and carbs, which has carbs inside, this is going directly straight into your blood and causing these dangerous spikes. Yes. So it's always important. And there again, CGM can help you, continuous glucose monitoring, because then you can see how this kind of food is impacting my glucose level. Because again, my body is reacting different than anybody else. Yes. So I can eat maybe a watermelon, I can get no spike, and another person is eating the same amount and can have a heavy spike. So therefore, it's needful to understand your body and to learn how it's affected through that what we are doing. Here's a really nice question. How can you reverse diabetes? Well, there is a big discussion, and is it reversible or not? I will be really cautious. As I mentioned, you can get diabetes in remission. So this means your sugar levels can get in a normal level and you don't need medication. But we know from some studies that these patients are still have a higher risk to get other complications than somebody who did not have diabetes. Yes. Prediabetes, for example, is reversible because we have seen that if you maintain this and you avoid to get diabetes, yes, your risk is like a healthy person. In diabetes, it's not the same. Yeah, somebody's asking about keto diet for reducing weight. As I mentioned, yes, it can be successful. It's not for everybody, and you can do it over a period of time. Depending also of which kind of other diseases you have. For example, if you have a high cholesterol, you have to rethink if you do a keto diet, because we know in the keto diet your cholesterol levels can be elevated. So in my opinion, again, not every one diet fits for everybody. So it's important to first analyze the patient, to see his risks, and then to find for him the right diet and something which can be for long term. Somebody's asking about BMI. Yes, BMI is very important. The guidelines for obesity and overweight is going over BMI. Overweight is between 25 to 29 and obesity is over 30. And these patients generally both have then a higher risk to get a metabolic disease like diabetes, cholesterol, or blood pressure. Somebody's asking what are the characteristics of type 1 and type 2 diabetes patients. As already mentioned, that type 1 is more frequently in children and young adults, and type 2 in more elderly patients. For type 1, which is symptoms which you really can see often, is that they are losing very fast weight and they get a blurred vision, and they have very often increased thirst and urination during all the day. In type 2 diabetes patients, it's more the fatigue, it's more the chronic condition of losing concentration and get skin infections, generally more infections, and they have typically more frequently urination at the night. So this is one of the differences. Some people are asking, are there any activities, operations forbidden for those with diabetes, such as work at high operation heavy-duty machines, etc.? It depends which type of diabetes you are, what of medication you are taking, and of course how you're managed. There are certain guidelines for that even those who are type 1 and on insulin, if they are managed over a period of time well, they can do also this kind of works. But this is really individually. This needs risk calculation and a decision between the patient and the physician to see if it's secure for the patient or not. Nice question. I like chocolate. I usually eat 1 or 2 bars a day. Is this harmful? I'm not overweight, maybe a little. Again, as I mentioned, it's not only what you're eating 1 time per day, it's really the holistic thing. Yes, and that's what we have to think about. That's why you should meet at least your healthcare provider to find out if there's any risk for you to get diabetes. So as I mentioned also, every metabolism can be different, and maybe you can have not a problem with that. But as you say, maybe you're a little bit overweight, and then the risk definitely can increase. Somebody is saying already that she or he lost about 50 kg as a type 2 diabetes patient, which is really great. And they're asking for the right diet to retrieve my weight. Yes, that's what we are saying. Yes, you can lose really grateful weight, and then it's important to see as a next step what is impacting your body. So which meals you can have, and you can still enjoy your life, and it's not impacting your blood glucose, and it's not impacting you to get again overweight or obese. How are your time? We're good? Good. I mean, there are some more questions. Should I reply them? Okay, good. Let me see. Somebody saying fasting sugar is 105. What I should do? Yes, meet your healthcare provider, because this is a sign at least for prediabetes. Somebody's asking the symptoms which you have prescribed, will one have all symptoms or one of them? Again, you can have only one of them, you can have more of them. It's really individually, and therefore it's important if you have symptoms to get to your healthcare provider. If you don't have them, at least depending of course on your age, you should have your frequently checkups. So somebody's asking, taking medication throughout the lifetime for diabetes, or can it be prevented, or can we, if I stop medication, can it impact a cause or other problems? Again, the first step why we're using medications are normally for those patients who have very high levels of glucose. So the guidelines is saying if the glucose is stable, of course it's diabetes. It's not a normal range. But if it's in a range where we can decide that it can be changed through lifestyle, we should strive with lifestyle. The first 3 months, we have to give, as per guidelines, our patients the time to change their lifestyle. And after that, if we see not improvement, we can decide to go to medications. And again, the benefit, what we are saying is, I don't want to wait 3 months to tell you this. Let me connect you and remote control you and give you immediately, after weeks already, a feedback and see how you can change, how you can do better, yes, to avoid medication. Somebody is asking for a person who is over 70 and has diabetes and cholesterol and had recently even a stroke to find the right diet. Look, as I mentioned, it's always really individually. I would not say directly to you that use this diet. Yes, so it's important to see the patient, to see the results, and to analyze the patient and see what is impacting him, and then to find the right diet. So I think yes, somebody is saying I love baklava and I'm sure this is not good, but how I can balance and burn and avoid risk of being diabetes. You've mentioned already some important things that yes, balance and burn through activity. Yes, through activity, of course. If you eat something sweet, look, your body is like an engine. If you put energy inside and you're not using it, then you can get a disease like diabetes or overweight or cholesterol. But if you take this energy and use it again, of course, then you're burning this and then it's better. But think about, like I mentioned, with the neighbor and the guests, even with time, if you're doing exercise and you're doing well, if you not do a healthy diet, still you can get diabetes if you eat a high amount of carbs, because then you can still get the insulin resistance, because it's coming too often to the cells, even if you're doing exercise, yes, and with time in all the ranges, you can get diabetes. Good, thank you very much. I hope you enjoyed and I could answer all the questions for the time I had, and thank you very much.